It was nearly 30 years ago, while on surgical rotation in medical school, that I had my first experience inside the operating room. I was assigned to assist a surgeon to amputate a patient's toe, a moment that opened my eyes to a harsh reality. With all we knew, we couldn't fix this problem. So we had to sacrifice his limb in order to save his life. Now, this changed everything for my patient. Not only would he struggle to regain his physical balance, but now he would have to carry that heavy grief of losing a part of yourself. An amputation occurs somewhere in the world every 20 seconds. And early in my career, I observed this same sad fact. Amputation after amputation, I kept wondering why. What's going wrong here? What are we missing? As a radiologist, I wanted to do something to help. So I designed a research study to see if obtaining an early MRI could help us reduce the rate of amputation. My teams and I scoured the medical records of over 368 diabetic patients. And while we found that getting an early MRI did not decrease our amputation rate, my research uncovered something unexpected. For those patients who did get an early MRI, they had a significantly decreased death rate. And what that means, plain and simple, is that those who get an MRI lived longer. But why? Why would getting an MRI give years to your life? And this is where it gets fascinating. When we thought about what could be happening, one single patient stands out for me. Let's call her Maria. Now, Maria's foot problems weren't just about her diabetes or her genetics or even just her lifestyle. It was the complex interaction of all these factors intertwined. The MRI was more than just a diagnostic tool. It was a wake-up call. It catalyzed communication between us radiologists, the physicians, and the entire healthcare team. That was the key. Together, our effective use of this information helped to not only save her toe, but possibly her entire life. One of the biggest problems in healthcare today is that our systems are deeply fragmented, with specialists so focused on one particular area that we can miss the broader picture of patient care. This narrow approach, where you're encouraged to stay in your own lane and discouraged from stepping outside our specialty, can undermine the health care of our patients. And not only does it affect the health care of our people, but it causes division amongst us caregivers, turf wars. Without the patient in the center of our focus, we run the risk for seeing crucial gaps in care. So what's the solution? I believe we can make a positive impact by building lifelong learning communities inside of medicine. Safe places to discuss things across the specialties. By sharing both our successes and our failures, we encourage belonging and mutual support. Tapping into the power of our community's collective strength not only helps to heal the patient, but also us caregivers. And I believe that this could impact many other industries, especially those with siloed workplaces. So, how are we going to make this a reality? Number one, we want to acknowledge our own imperfections. Every day, I face issues that leave me with a sinking feeling of overwhelm. I just don't know the answer. The solution starts there, admitting that we don't have all the answers. And what's more, it's okay not to. Number 2, face the reality. What's not working today or not working as well as you want it to? Take a blameless inventory and get clear on the weakest links in our system. And number 3, add those insights to action. Call people, speak to them, ask the specialists what they think. By tapping into the collective strength of our people, we can build out a vibrant, vital community where every member of the team counts. Now, this is not the time to get cold feet or be defeated. Every great change begins with that first single step, and it's time to get on point. Doctors, call your specialists, reach out, share your weaknesses, your blind spots. We all have them, and no one of us are alone. Patients, ask those tough questions. Don't be afraid to ask the same question again. Get clear on what you need to be well, even if it means stepping on someone's toes. To keep our toes tapping and truly make a difference, we need a healthcare system that focuses on the patient and favors collaboration over competition. The future of healthcare isn't in further specialization. It's in the compassionate steps that we take together to build a lifelong learning community. Thank you.